As I stand here, I'm literally thinking and watching the clock in front of me tick. The clock is ticking. Time is running out. There is a sense of urgency for those of us who are standing up here. And so I know the leader would say he doesn't consider this his plan. He considers this the American plan, that we do something. And I will tell you, as was said by my colleagues, I come from the state of Delaware. And anyone who knows Delaware knows that we are urban, suburban, rural, and coastal. We have farmers. We have small businesses. We have environmental justice communities that are impacted, even by cafe standards. And so I will tell you, yesterday, when I was looking at my television and seeing our Republican colleagues at the White House, what I thought they were announcing was a healthcare plan. I was shocked that what they were announcing was something that would make us less healthy. And so as I stand here today, I think about the years of my work in this space of health. I served as Deputy Secretary of Health and Social Services in Delaware and got to see the impact of healthcare. I served as head of state personnel, so I saw healthcare from an employer perspective and how much it costs and how do you keep people healthy. I served as CEO of the Urban League, so I got to see health disparities and how in this country, as rich as we are, we have one of the highest maternal mortality rates in the world. So healthcare to me is a basic necessity. It's what drove me to run in 2016 and what I fought for. And times it's sort of like history is repeating itself or rhyming. Because I came in, Donald Trump was president. Republicans had the House and the Senate. And as was said, there were calls for repealing and replacing the Affordable Care Act. What we recognize is that the Affordable Care Act is not perfect. But one thing I do know is that that family who has somebody with a pre-existing condition like asthma or diabetes is grateful. That parent who has a kid who's 22 or 23 is grateful. And so what we're saying here is very simple. We have an immediate problem, an immediate crisis, an immediate cliff, and we need to take immediate action. And that's why we're proposing the 3-year time frame to allow us to also work with our Republican colleagues to make the substantial changes that we need to make us a healthier country and to make sure that we have a healthcare system that's working for all of us. I came up here with a whole bunch of notes and really didn't use any of them because it's really that basic. It's really that simple. We're proposing something that will help right now while we also give time to work together. I have stories of Delawareans, as my colleagues do, small business owners, rideshare drivers, young people who are concerned. For the first time, I had a resource fair. For the first time, people were lined up hugging me, saying, please help us. Please. And so we stand up here on behalf of the hardworking families. And we also stand up here to say, for anyone, including the president, to say that this is a Democratic hoax. Right now, people are looking in their email and in their mailboxes, and they have the receipts. It's happening now, and we need to act now. And so I thank you, Leader Schumer, for your leadership. I'm fortunate that I had the opportunity to also work with Senator Wyden on legislation, the Protecting Patients and Affordable Care Act, that focuses on not just the 3 years, but it is in tandem with this to make sure that some of the harmful things that were already done this year through the Big Beautiful Bill and through regulation are actually are pulled back so that people, again, don't fall off a cliff, and that we're making sure that they're able to navigate this system. Again, I'm glad to be standing here before you, but I'll be happier when we pass this legislation.